Hello, and welcome to Pemco University. My name is Chris Deal. I will be your moderator for the course Rultract Skyhook Retractor System, Instructions for Use, Cable Replacement of the Rultract Skyhook Retractor System. This course is designed for healthcare professionals who wish to further educate themselves on the proper cable replacement procedures for the Rultract Skyhook Retractor System. And from now on, I'll just call it the Rultract. Operating room staff, nurses, sterile processing professionals, and physicians may benefit from the information contained in the course. This course has also been approved for 2 continuing education credits by ISHM, the International Association of Healthcare Services and Materials Management. It is available for study from now until March of 2020. After completing the modules, the student must pass a quiz with a score of 75% or higher, and after achieving that passing grade, you will have access to print a certificate of completion for submission to ISHM and award so that you may be awarded the appropriate credit. So without further ado, let's learn how to replace that cable in the Rultract. So the objectives are pretty straightforward. I want to walk you through a brief description of how the Rultract Skyhook Retractor works and a little bit of history about Rultract. Identify, again, you'll learn to identify when the Rultract must be sent back to the manufacturer for repair. And you will also be able to explain the 10 steps for replacing the cable in the Skyhook system. Included with the course are documents for download and a demonstration video that will help you apply these learnings to your clinical situation. The cable, while easy to exchange, still requires some technical expertise that can be learned pretty quickly, and it's pretty simple once you get it squared away. So the agenda for the course, this module will be the introduction to Rultract and a brief description of the Skyhook system, full system overview. The second module will include instructions for use, replacing the cable. We'll go through the 10 steps. Brief summary and some acknowledgments, and then the third module will be the quiz that you must pass. I'm sorry, the third module is going to be a video, then a quiz that you must pass. So a little history about how the Rultract Skyhook Retractor came to be. The Rultract retractor was invented in 1966 by Philip Rouleau Sr. at St. Vincent Charity Hospital in Cleveland, Ohio. Mr. Rouleau was a perfusionist and a lab tech who worked in the animal labs in the basement of the hospital on weekends. And that's where they worked on experimental valve surgery on animals. He invented the retractor so that he would not have to stand at the exam table and hand retract the chest for hours at a time. Truly, in this case, the necessity was the mother of invention in this case. So the name of the company originated from Phil Rouleau's family name, Rouleau, and the word retractor, Rultract. So while he invented the Rultract retractor in 1966, Rultract Incorporated did not become a company until the 80s. And the first Rultract retractor was sold in 1986 and is now used in over 1,200 cardiothoracic centers in over 40 countries. Rultract is an American company based in Cleveland, Ohio, specializing in American-made surgical retraction systems. The Rultract Skyhook system is considered a Class II medical device and has become the established standard for many surgical procedures. And I'll highlight a few of those as we move forward. The Skyhook provides gentle and uniform lift, allowing for maximum exposure of the surgical site. And coupled with 316L American-made stainless steel, the ease and setup and operation sets the Rultract retractor apart from other retractor systems on the market. From the list here, you can see that of the top 20 heart centers in the United States, as defined by U.S. News & World Report, we have Rultract retractors in every single one of these. So maybe you see your hospital on the list. So the Rultract Skyhook retractor system is very versatile, provides excellent exposure in a broad range of surgical procedures, and some highlighted surgical procedures are cardiac surgery, thoracic surgery, and abdominal surgery. And again, just note that the Rultract retractor is considered a Class II medical device. A little hint, that's for the quiz. Special features of the Rultract are that it is a one-person operation. And once the learning curve has been decimated, to say, setup time is approximately 1 minute. So one person, 1 minute, so it's very easy to set up. The adjustable ratchet assembly allows for upward and outward retraction, and that's where the cable comes into play. That versatility of the cable allows for many angles for the retractors to be, or the rakes to be placed. Each rake pivots independently on the rake plate. The ratcheting system gently and evenly elevates the sternum in approximate increments of 1 millimeter per click. The ratchet is reversible, and that allows for a quick directional change if needed. Easy to gear up or also release and come down. There are accessories available, and they are designed now to attach to all current systems on the market for Rultract. And the snap clip provides for single rake retraction as well. So you can use multiple attachments to the snap clip for multiple surgeries. One thing we want to make sure, though, is that safety to patients. The Rultract has been shown to provide less sternal fracture and costochondral separation and less post-operative paresis with the double bend bottom post. So briefly, just review the different Skyhook retractor sections. They're parts per se, but they're also different sections. Section 1 is the operating room table clamp. There are different styles based on the year that the Rultract was placed in service, and those styles are continually being redeveloped such that we have one single clamp now that we'll be working with in the future. However, all older Rultract models will be serviced. So if the table clamp seems a little loose or it's not holding properly, that's a good time to call the manufacturer and get it replaced. There'll be more information on that at the end of the course. So Section 1, operating room table clamp. There's a circulator applied, a scrub applied, and then a combination clamp. Section 2 is the bottom post. The bottom post fits into the operating room table clamp. The double bend allows for more space by either an assistant or, depending on the size of the patient, allows for more space for the patient's arms and shoulders. There's a spline setup and a square setup on the bottom post. Those allow for varying degrees of rotation on the bottom post to position the top post correctly over the patient depending on the surgical procedure. Section 3, top post. There's a extender post, a regular top post. There's also a tilting top post and a rotating top post. There are some extensions to the top post that allow for, again, bigger size patients, coupling to another Rultract on the opposite side of the table for paniculectomy. I'll show you a picture of that in a second. So lots of variability and lots of ways the Rultract can be used to help lift when hand retraction becomes tiresome or it's needed to have a nice, gentle, strong, firm lift in marginal increments. Section 4 is the gearbox and then the attachments. So the gearbox is the heart of the Rultract system. That is where the gentle lift is applied. The gearbox is reversible to allow for the snap clip and rake plate to descend and ascend as needed. And again, we'll go into more details here because this is going to be the heart of this course and where you will want to pay attention on how to change out the cable. Section 4 also includes then the rake plate attachments, There's single rakes, there's the rake plate for IMA, which is the one shown in the picture, and again allows for lots of various procedures where the Rultract can be used. And I'll just highlight a few of them here. Surgical procedures with the Rultract, the most popular is IMA dissection or mammary artery dissection. The Rultract is set up on the operating room table opposite of the physician. The left side of the chest, once it's opened, is lifted so that the doctor can then go in underneath the left side of the chest, dissect the mammary artery for heart bypass. The top middle picture, actually let me go to the top, to the picture on the right, and that is sternal elevation for pectus excavatum repair. Again, the Rultract is placed on the side of the patient, and then you can see how the extender bars and the rotating bars are used to position the sternal lift directly over the patient's chest. And here the patient's chest is lifted in order to allow for passing of the pectus repair bars through the rib cage. And this creates enough space so that when the bars go through, there's less chance of damage to vital internal organs. All right, so bottom center is paniculectomy. And here you can see two Rultract systems set up, one on either side of the patient on the operating room table and coupled with a coupling bar. Multiple gearboxes and retractor plates are then used to lift and hold the large mass of tissue that is being removed from the patient. And you could see how that would be very tiresome and very difficult to do if you were trying to hand retract that. So the Rultract retractor really provides a great service here for the physicians to do their job. Most recently, pediatric cardiothoracic surgeons in Florida worked with the Rultract retractor and developed a new rake attachment that lifts and separates the sternum for resternotomy repair in children. So we've had a version of this for adults who need resternotomy. But now with the children, you have the opportunity to do resternotomy there with gentle lift, and the retractor then also spreads so that the doctor has greater visibility and has more space to work. Again, this helps to minimize damage to delicate structures inside the kids on the table. There's an accompanying course on the Rultract retractor. It's an overview with also instructions for cleaning and sterilization. I suggest you take that course for more information on the different pieces and parts to the Rultract retractor system. And next we'll get into the details on how to change out the cable. So go ahead and finish up this module. There should be a little checkpoint quiz, and then we'll move on to the cable replacement instructions.